we're not going to go too much longer. I want to point out one of the things that you sort of bring to the forefront, one of the things that you brought up, which is that pelvic floor muscle spasm. But interestingly, in association with the severe anxiety, is the issue with other things that are then caused by having severe anxiety. So now we've got this sort of rolling problem. I think we're having an audio problem with Dr. Davison, so I'm going to talk, and then kind of we'll try to fix it after. So we've got this severe anxiety that then leads to, what does everybody know? What do they get from severe anxiety? What's the result of that? What happens when you're super anxious or there's super problems or you're super stressed? Let's use the word stress. When you're super stressed at work or there's something going on in your relationship or there's something else going on, what happens when you're super stressed? You get sick, right? So why do you think you get sick when you're super stressed? Probably because, speaking in general terms, there is a lower level of function of your immunologic protection. And there's probably a lower level of general function of your immune system and your immune response. So one of the things that we're seeing more prominently and more commonly during this time are vaginal infections, vaginal bacterial infections, vaginal yeast infections. And while these things are common in our world at baseline, they're super common in our world now. Now, in general, from our standpoint as gynecologists and pelvic surgeons, that wouldn't be a big problem. It's uncomfortable, it's inconvenient, it hurts, there may be an unpleasant odor, and some itching. There are all sorts of unpleasant things that go along with this. But in our world, as people who take care of women with chronic pelvic pain, vaginal infections can be an absolute nightmare for our patients. Why is this? Why does that happen? I don't understand. I think I do. Um, Vaginal infections, just like any other infection, are associated with a very high level of inflammation. So when you get an infection, you can get very inflamed in your vagina, but it's not just your vagina. It's your bladder that gets inflamed. It's your pelvic floor muscles that see those inflammatory mediators. It's your urethra, where you urinate from, that see those inflammatory mediators. So that becomes a really super big problem in association with people who have existing underlying pelvic floor muscle spasm. So what happens when those pelvic floor muscles that are already sensitized to an issue, what happens when those pelvic floor muscles see a big hit of inflammatory mediators? They respond because that's what they're supposed to do. They're supposed to respond. And just like any other skeletal muscle in your body, your pelvic floor muscles are just like the muscles in your arms. They're just like the muscles in your legs. And they're skeletal muscles, and they react to inflammation. And how do they react to inflammation? They react to inflammation by contracting, by shortening. And it's that very contraction and shortening of the muscle fiber that causes and is associated with that feel of muscle spasm, which then leads to that pain cascade. So here's the problem. Once we treat that vaginal infection, which we can do routinely, just like any other vaginal infection, but once we treat that vaginal infection and the inflammation improves and goes away, the muscles do not necessarily calm down, relax, and get better. And therein lies the bugaboo. Therein lies the problem associated with taking care of women with underlying pelvic pain, sexual dysfunction, urinary and bowel dysfunction, in association with COVID-19 related stress and anxiety, leading to potential vaginal infections, and then creating a much worse and much more difficult to deal with and much longer term problem with the pelvic floor muscles. So I hope anyone who's listening, if you have any questions, will let us know. we're certainly happy to answer them. And I certainly promise that we're working on fixing Dr. Davison's audio feed. And I certainly know that we'll have her on again because she's super fantastic and super smart and super able to answer your questions. She was kind enough to do this at the absolute last minute, literally got herself together in like no time, and we did not have an opportunity to test her audio, which we would otherwise have really liked to do. Um, so if there are no questions, we'll be back next week. And I think next week we'll be back with Dr. Davison, if that's okay with her. All right, so she's giving me a big thumbs up. I know you can catch Dr. Davison on NBC today. Is that true? So we'll post Dr. Davison's interview on NBC. You want Dr. Davison? I don't think anyone can hear, but do you want to tell me what you talked about, just in brief? Great topic. Great topic. So Dr. Davison's going to be on NBC talking about canceled surgeries, the effects that those canceled surgeries may have had on patients' well-being, their general health, what effect it's had on the physician's ability to offer them the highest level of quality care. So look for that, and we'll certainly post it on Facebook and our YouTube, our Facebook page and our YouTube channel once that link becomes available. So please subscribe to our YouTube channel. And this wraps up our very difficult, technically, first edition of Women's Health Weekly. And we hope we can come back to you next week with a better version, a better technical version. So thank you very much, everybody. Stay well, be well, and take good care of yourselves and your family. Thank you.